The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, all TMD warriors who are with me today. Welcome to TMD Demystified. I am Tony Urbanek. Today, we are going to discuss and take a deeper dive into the logic of TMD treatment and the illogic of TMD treatment. The title of today's episode is Logic and Illogic of TMD treatment. Offhandedly, I've covered to some degree each of the parts of what we're going to discuss today throughout our course on TMD and treatment of TMD and use of the Urbanek device and protocol, and also partially in other episodes. But I sometimes am amiss in not understanding or remembering that sometimes a viewer watching a specific episode is not schooled on many of the other things that I brought out at different times. So I'll run through the basis and then the basics of the logical direction of the treatment of TMD. As you all know, there are lots of theories. There are lots of treatments that are being rendered for headaches, for muscle pain, both medical, surgical, and physical. But the issue that I have with this, and the issue after treating and getting out of doing surgery for the temporomandibular joint and treating successfully well over 3,000 patients in our own practice, and now developing a network of doctors throughout the United States who use the device and protocol successfully as I have, it has really come to my attention as, number one, how huge this need is for patients who suffer from the basic symptoms of TMD, which is not just headaches or not just jaw pain, but most frequently, a combination of multiple symptoms that come down to the cause of those symptoms, which is inflammation within the temporomandibular joint. That is what I've discussed many times. We dissected that out in detail. It is a proven entity, not only proven through my own experience in 3,000 cases, 3,000 plus cases, but now our independent study, which has verified what I say and what I've talked about, what our experience is, and that is unloading the joint long enough to relieve the inflammation in the joint makes all of the symptoms go away, not necessarily simultaneously, because they all go down at different rates, but makes all of those symptoms diminish and go away. And the symptoms are frequent or recurring headache, earache, jaw pain, neck pain, ringing in the ears, feeling of fullness in the ears, vertigo, dizziness, shoulder pain, and upper back pain, arm, hand, finger tingling and numbness, and various types of locking. And there are other issues, other symptoms that are not so common that I'm not going to discuss today because I'm still doing some investigation on them. But the one I will mention, and I mentioned it before, I did an entire episode on it, and that is the diminishment of visual disturbances that are often and most likely connected to migraines. And when you decrease the inflammation. Now, we've talked extensively how inflammation within the temporomandibular joint will physiologically, anatomically cause all of those symptoms. I'm not going to go into that. What I'm going to go in today is the illogic or logic of the treatments that are available. And as a disclaimer, my intention isn't to diminish or criticize any treatment or any group of people who believe in doing this, that, or the other, whatever they do. But we have to confront it directly and talk about it so you understand what I'm trying to teach, what I'm trying to get across. Again, how inflammation causes, let's just say how inflammation causes arm, hand, finger tingling, and numbness and shoulder pain is well covered in the course we offer and well covered in some of the segments and episodes that I've discussed. But let's talk about the logics and illogic of TMD treatment. Just to mention, I don't have a list, but TMD is treated with drugs. I've seen many people placed on psychiatric drugs, muscle relaxants, pain medicines. I've seen more than my share of people that are addicted, have become addicted to narcotics because of the chronic pain given to them by their practitioners. One of the most common treatments nowadays for headaches is Botox, paralyzing the muscle or set of muscles on the face or neck or wherever you have a tight muscle, and muscles do go into trismus. And we've established that muscles that go into trismus pull on the bone, and when the muscles pull on the bone, that's where the nociceptors are. And so it's where the muscles are attached to the bone that hurts. If you can relax a muscle with massage or physical therapy or even Botox, if you can relax that muscle, it's not going to pull on the bone, and that particular pain will go away. But what about all of the other symptoms that are associated and caused by, concurrently in that particular patient from inflammation within the temporomandibular joint? You're missing your opportunity to treat all of those symptoms which the patient has. Admittedly, inflammation in the joint does not cause all of those symptoms in each and every patient. In my experience, most patients have 4 to 6 to 8, many have 10 or 12 of the symptoms simultaneously. Painful symptoms go away rather rapidly within a week or two after relieving inflammation, unloading the joint, relieving inflammation. Painful symptoms will start to subside within a week or two. Tinnitus, subjective hearing loss, which is fullness in the ears, and vertigo go slower. Tinnitus is almost always the last symptom to diminish and go away. It may take many months, 6 months, 8 months, 10 months. But getting back to the topic, so here's the logic behind it. If you are just treating symptoms and not the cause, you may not know the cause, but if you're just treating symptoms, you will hopefully have an effect on that particular symptom. But again, you're missing the opportunity to get rid of all the symptoms for the patient. And most of the patients are not aware that those other symptoms are related to their TMJ. I mean, I've heard hundreds of times, do you mean my shoulder pain that I've had for 10 years is coming from my jaw joint? And I go, yes, ma'am, absolutely. And when you unload the joint and the inflammation in the temporomandibular joint diminishes, then the shoulder pain goes away, along with related arm, hand, finger tingling and numbness, or their headaches, which is probably the most common. Do you mean my headaches that I've had for 30 years have been coming from my jaw joint? I've been on medication for 30 years. Well, do you still have headaches? Yes, I still have headaches. Pretty disappointing from my point of view. Back to the logic. So here is the dominoes of TMJ. There are only three, and again, I've covered this, but there are only three causes that develop inflammation within the temporomandibular joint. The real causes are bruxism, which causes chronic damage within the temporomandibular joint, acute damage, trauma, that causes damage within the temporomandibular joint, and functional malocclusions. They can be little malocclusions, they can be big malocclusions, they can be orthognathic kind of malocclusions, but functional malocclusions can cause damage within the temporomandibular joint. Those are the actual causes. I have not run across, in 5,000 consultations plus, any other cause. And not everybody has, in fact, most people don't have all three, although I've run into many that have all three causes. The most common cause is bruxism, clenching and grinding over many, many years, chronic trauma to the temporomandibular joint, which causes inflammation, acute trauma, 4x4s off the back of the pickup truck, or motor vehicle accidents is the most common, with whiplash being one of the most commonly seen causes of traumatic events within the temporomandibular joint, and then functional malocclusion. But what do each of those do? They create inflammation. So the common denominator of the three causes is inflammation within the temporomandibular joint. Now, can you stop or interfere with any of those three causes? Well, number one, bruxism, we do not understand. We doctors do not understand the mechanism for bruxism. The only thing we know about bruxism, it's related to stress. We know that there is a mechanism within the brainstem which gets stimulated by stress and will stimulate clenching or grinding. Intuitively, we see it all the time, but we don't have that mechanism perfectly understood or even generally understood. We're not sure about the transmission of these signals. All that we can say with certainty is that clenching or grinding the teeth is related to stress. And we do not even have a good definition for stress. And we definitely have no on and off switch for bruxism. Patients are not going to stop. And I have run across many patients that say, Dr. So-and-so, or I heard, or I read that you do this or that, and it will keep me from grinding my teeth. Bogus, not true. Half the population grinds or clenches. Most of them are even not aware they do it, but half the population grinds their teeth. And if you do it long enough, severe enough, with enough force, you're going to damage the internal structures within the capsule of the joint, and you're going to create chronic inflammation. So there is no on and off switch, either externally or internally by the patient, that is going to stop people from clenching or grinding. There are times when you do it more. Under loads of stress, you do it more. If you can unload stress, unload your problems, it can be helpful, but people who have the habit are just going to do it. So there is no solution to stopping clenching or grinding, number one. Number two, acute trauma, automobile accidents, whiplash, and other types of trauma to the face and the jaws. It's water under the bridge. It's over with, and whatever damage is done. So you're not going to have an effect to be able to stop that. And the third category of cause of inflammation in the temporomandibular joint is functional malocclusion. And admittedly, there are things that can be done to correct functional malocclusions, and I recommend them frequently when I recognize that either a small or a large functional malocclusion can be corrected, needs to be corrected, and they are sent off to combination of either the orthodontist or the orthodontist and oral maxillofacial surgeon, or a reconstructive dentist if it isn't too large a functional malocclusion and it is appropriate to reconstruct the occlusion. I won't go into what the percentages are. I'm not sure about the percentages, but the point is it's a valid treatment that can unload the temporomandibular joint. And what I have seen on many cases is that when I run across someone who has a large, which I'm very familiar with, great functional malocclusion associated with orthognathic surgery and a big jaw, little jaw, big open bite. I have worked with the orthodontist to get them into a normal bite. And those patients who have and do exhibit temporomandibular joint symptoms, it's a 50-50 success rate to get enough load off the joint to make the inflammation go away and the symptoms go away. So 50% of the time after correction of the functional malocclusion, no more TMD symptoms, which is awesome. 50% of the time, they still have symptoms, at which point we put them back into the device, separate the back teeth, getting them into nighttime only, and over a period of time, that's enough to get the inflammation to decrease. So the only actual cause of the three causes that you can make an actual effect on is correcting functional malocclusions in some cases. Literally 50% of the cases, which is a valid treatment. Now, we're talking logic now. But the common denominator of all those is inflammation. So if you have inflammation within the joint that causes that entire list of symptoms, why would you just want to focus on one service or one treatment for their shoulder pain or their facial pain or their jaw pain? Or their, arm, hand, finger tingling and numbness. I've had many people who have complained of arm, hand, finger tingling and numbness for years to their physicians. And when inflammation within the joint went away, quote, magically, their arm, hand, finger tingling and numbness diminished. So we have a litany of treatments out there that I mentioned. One of them is Botox. If you just paralyze a particular muscle or set of muscles to create that particular pain to go away, you're missing an opportunity to fix the whole problem. Physical therapy on a muscle, set of muscles, or even on the mandible itself. Physical therapy may have an effect for a short period of time, but again, it doesn't address the actual cause of, or if you want to call it a sub-cause, because the causes are of TMD are bruxism, trauma, acute trauma, and functional malocclusion. But the common denominator of all three, or sub-cause, if you want to call it that, is inflammation in the joint, and unloading the joint long enough will decrease that. Decreasing inflammation, if you want a little validation on this is why non-steroidal pain medication, non-steroidals work really well for a period of time. What are they doing? They're just decreasing the inflammation. Unfortunately, non-steroidals, Motrin, Tylenol, or aspirin will only be effective for a short period of time, as we all know, 2 or 3 weeks. If you take it constantly, 2 or 3 weeks, and all it will do is it will not affect this any longer, and it will cause gastritis and tear up your stomach. Reported by almost every patient who tries that method. Almost every patient consistently. Dry needling, that's one that comes to mind. I have a case, just a case of an example. I hear it a lot. A lot of people go into dry needling. The physical therapists are constantly doing that treatment on a muscle set, which apparently will relax a muscle enough so that it won't pull on the bone and cause the pain that the patient is complaining about. Of course, After a while, the pain returns when the muscle gets tight again, and it will. But the problem with some of these treatments, like dry needling, I have a documented case. I won't go through it. I talked about it on a previous episode, where a patient actually, the needle went too deep and created a pneumothorax, and the patient ended up in the emergency room and had to have a chest tube put in because of dry needling. The case that I had, I bet it's not the only case that occurred like that. So that's a complication of dry needling that nobody talks about. And so it goes on. I have 2 documented cases where the patient was diagnosed with key area malformation, which is a neurological condition, which is a valid condition. Key area malformation is the herniation of the brainstem through the foramen magnum. If you follow, the base of the skull, the foramen magnum, the herniation of the brainstem down, which can cause headaches. But I have 2 documented cases where the patient went through neurosurgery and enlargement of the foramen magnum, big operation, where the actual cause of her headaches, both of them were female, was inflammation in the joint, and they were temporomandibular joint headaches that had been misdiagnosed. It goes on and on. So the point I'm trying to make, again, with the logic of this, is why would a practitioner, a well-intentioned practitioner, who has the proper credentials to do whatever he's doing, just treat a symptom and not look for, or at least put on his differential diagnosis, that the headaches or the earaches or the jaw pain or the neck pain, the ringing, fullness, dizziness, shoulder pain, arm pain, finger tingling, numbness is coming from inflammation within the joint, and not just go for a treatment which they can perform but only treats one of those symptoms. It's not logical. It's incorrect. It's not logical. So it seems best to treat the cause, inflammation within the joint, rather than just symptoms. And if you can get treatment of one area to make all of those symptoms go away, you're much better off, for sure. So if you have, and this is a general comment about looking at a problem, if you have a problem, in this case TMD, and you find a solution, which I didn't discover anything, I just connected the dots. I've realized after a rather lengthy investigation how inflammation within the joint causes all those symptoms, and that inflammation in the joint is the primary cause. Why would you address each of those symptoms individually? Attack the cause, not the effect. Attack the cause, not the symptom. And so we have a lot of practitioners out there running around just treating symptoms one at a time. One at a time. I made my point today. I don't want to belabor it. If you, whether you're someone who has watched multiple episodes of TMD Demystified, or you are brand new to the Urbanic device and protocol and our episodes on TMD Demystified, if you are interested in using what we know and the device which unloads the joint, makes the inflammation go away, you can contact me at Tony Urbanic at tmjservices.net, or our Director of Marketing and Education, Naomi at tmjservices.net. I look forward to hearing from you. If you have questions, if you question anything, I'm happy to take questions. I'm happy to take criticisms. I respond to everyone. at any time, for any reason. I'd like to communicate. So please contact us. We have a course which takes you through the entire, not just the mechanisms, how to treat it, but understanding exactly what I learned, exactly how all this comes about. And it's in an online course, which you can take and then become licensed to use the Urbanic device and protocol, which I highly recommend for your practice. Value of your practice, it brings in a lot of patients, you help a lot of people. They are very, very grateful when you make these symptoms go away. That's the fun part of it. How great I have a greatest job, and the other doctors who do this have a great job, because you get a validation every time that you do this, and patients are extremely grateful after being run around in circles, doing many different kinds of treatments, and it's a blessing for them. That's what I hear in many different ways. So contact us. I'll be happy to discuss any part of this with anyone. And for that, I will finish it off today. Have a great week. I look forward to talking with you the next time. I am Tony Urbanic, and this is TMD Demystified.